In psychiatry and psychology, there are no medical tests, no scans, no blood work that can diagnose anybody with a mental disorder. When they come up with a diagnosis, they literally do it by a show of hands, based on a vote. That is totally unlike any true medical illness where people have true physiological tissue damage or there is an actual test to verify whether somebody has a medical condition or they don't. If you have diabetes, you have it in every country around the world. If you have cancer, they can take it out of you and hold it and feel it. When you have ADHD, you can't hold it, you can't touch it, you can't see it, there's no way to medically verify it. It is a socio-cultural phenomena. If we like it or we don't like it, we can either label it or not label it. That is not a true medical condition. Definitely not a brain disease. We now have 1 in 5 individuals in America taking a psychiatric drug, only to find that these people taking these drugs now are causing more crime, having more disability, increasing more problems, suicide, homicide. Our culture is not looking at the problem that the medications and the diagnosing and the medicalizing of normal behaviors is making us worse. I can remember not that long ago when we used to have a war on drugs and everybody was supposed to stop taking drugs, and they lost that war because they couldn't control it. But then something interesting happened. All of a sudden the market got flooded by psychiatric drugs, which aren't that much different than the illegal drugs. And interestingly, the street drug dealer and the psychiatrist aren't all that much different, except for the fact that the street drug dealer won't tell you that you have a chemical imbalance. The street drug dealer is not going to tell you that you need to take his drugs, his cocaine. He's not going to tell you you have a cocaine deficiency. The psychiatrist, he's going to lie to you most of the time and tell you that you need the drug, that it's not going to be harmful to you, it's not going to be addictive, and that it's going to help correct some sort of chemical imbalance or genetic defect. In that case, for that type of psychiatrist, the street drug dealer is more ethical. And I'm not anti-med, I'm anti-misleading people. Let's not lie to people about it. Let's not pretend that this is medicine. Let's not pretend that this is going to correct something or somehow it's a treatment. This isn't a treatment, this is a drug. Just like any other drug, it's going to mess you up, it's going to screw you up. Let's just not lie to people about it. Let's not charge insurance companies. Let's not have the government pay for it. And God forbid, let's not give it to the young little children.